We will go now to the second part of my success keys, and now about problem solving exam. First of all, the first advice that you must avoid all abbreviations in the exam. This is not a chat or Facebook or LOL or like this. No. Avoid all abbreviations in the exam and don't expect that examiners know your abbreviations. And if you want to do this to save your time, at least write the word complete in the first sentence. For example, you will write diabetic retinopathy. In between brackets, you will write DR. Then in your workup, you can use DR because you already illustrated it in the first or the beginning of your answer. But if you didn't illustrate it, don't write it as abbreviation and expect that the examiner will know this. So avoid all abbreviations in the exam. The most important point about problem solving exam, you must know that this is not an essay exam. Imagine that there is a patient really sitting in your clinic in front of you and write exactly what you will do and what you are thinking and how you will manage your patient. The common mistake my colleagues fall in while sitting for this exam, they consider it as a theoretical exam. They consider it as a paper exam. This is a clinical exam in a form of a paper. Print this word in your mind. Again, this is a clinical exam in a form of a paper. You are dealing with a patient, and the examiner is keen how you will do for this patient. The examiner is keen how you will think about this patient. The examiner is keen how you will manage this patient. So don't tell patient from books. Tell patient from your clinical practice. For example, if you have a scenario about keratitis, okay, keratitis, and then you start your workup by saying that I will do scrapping and I will do staining and culture for the infiltrate, corneal infiltrate. And after this, I will give the examiner empirical fortified treatment, or I will give him fourth generation quinolone, or I will give him fourth generation oral quinolone. This is totally wrong. I am not saying what are the options of treatment. The examiner is not keen to know the options of treatment of bacterial keratitis, for example. He wanted to know exactly what you will do for this patient. So you must tell him, as I see this is a very serious, life-threatening, large corneal infiltration, I will go immediately for fortified antibiotic. I will give the patient vancomycin, fortified antibiotic for gram-positive, plus ceftazidime, fortified antibiotic for gram-negative, and then I will wait the culture result, and then I will modify it accordingly. If I find a response, good response to my medication, I will continue to my medication. This is what examiner wanted to know. He wanted to know what you will do, not what you read from books. So take care about this. This is not a theoretical exam. Again, this is a clinical exam. So you must imagine the patient and imagine what you will do for this patient if he is in your clinic. Be practical in your approach. Write what you will do for this patient, not what you have read from books. And I already illustrated this. This is the 3-step for a perfect answer in the problem solving question. You must first think, then you must plan, then you must get organized in your answer. When you face a problem-solving question, you must think first about the question. You must highlight the keywords in the question. You must link these keywords together. Then you must plan your answer. You will do all this while your pen in the table. You didn't catch your pen yet. You just think about the case and plan what you will do for this case. After you have a clear plan in your mind, then catch your pen and start writing in an organized way. The tendency, or if you have a prompt writing without a clear thinking and planning about the case, you will finish with an unorganized, not good answer. Dr. Hassanin is asking, have I to write conclusion at the end of each answer? You don't have to do this, and just wait me for 1 minute. I will answer this question more perfect. When you face a problem-solving question, you must impress the examiner with your introduction. You must make a good first impression. Write your first impression on reading the question. If possible, you must be able to impress the examiner with one sentence. Example, from the history and the clinical symptoms and the science of Mr. X, my first impression is like this. So try to link the keywords in the question, and from these keywords, write your first impression. Also, time is crucial in problem-solving exam. Give adequate time to each question in the paper. You have 4 questions in a duration of 2 hours and 15 minutes. I suggest to have 30 minutes per question to save extra 15 minutes for revision. And one of the common mistakes that if you go for one question and do it perfectly and take it a long time in this question, and then at other question you don't have time to write good in this question, this is a bad option, or not. This is a fatal mistake, because you give a full time to one question and ignore time for other question, and the examiner will not evaluate you for only one question. He will evaluate you for the total 4 questions. And also my advice here in regarding the problem solving questions, and may others have other opinions, that I advise all of you to start by the emergency question. Start by emergency question while you are fresh. This emergency question is the fatal question. You cannot pass the exam without passing the emergency question. So start by the emergency question, write in a proper way. Now you guarantee the success in this pass or fail question. Then start to answer the other questions, ophthalmology questions. Dr. MAOE is asking, do I have to write, for example, the definition of the disease mentioned in question? I don't understand what you mean. Please explain and I will answer. One of the fatal mistakes in these exams is to forget to examine the other eye, to forget to do systemic workup if needed, to forget referral if needed. Please, all my colleagues, remember that we have 2 eyes. So if in your workup, you must give attention to the other eye. For example, if you are presented a case of macular hole and you start to do your workup perfectly, you write everything, you write your diagnosis, you write your workup, you write your management, and you forget only one sentence. One sentence. What is this sentence? You forget to tell the examiner that I want to follow up the other eye because of the possibility of bilateral involvement in 15% of cases of macular hole. Just one sentence, just one line will fail you the whole question. Again, and again. I told all of you in my introduction, the main aim of the exam is safety. The main aim of the exam is safety. The examiner must be sure that you are a safe doctor, that you are a safe physician, that the patient will not be missed if he came to your clinic. So give attention to the other eye. Also, don't forget the systemic workup of if needed. For example, and this happened yesterday in my clinic. I faced a patient with peripheral ulcerative keratitis. So, if you face a patient in a scenario in your problem-solving exam of peripheral ulcerative keratitis, and you write about it very elegant, very perfect, you write everything, okay? And also you forget one sentence. What is this sentence? This sentence, I will refer this patient to a rheumatologist to control his rheumatoid arthritis. If you forget this, also you will not pass the exam, because as all of us know that peripheral ulcerative keratitis is not the disease itself. It is a consequence of rheumatoid arthritis, for example. So don't forget the systemic workup if needed. And also, don't forget referral if needed. What I mean by referral? Referral to other subspecialty or referral to other doctor. For example, you face a scenario of retinal detachment in the exam, and you started to write about retinal detachment and what you will do, what you will examine, and you will do fundus examination, and you will detect the tear, and whatever you will write. You must write at the end that you will consult a vitreoretinal surgeon. You will refer the patient to a vitreoretinal surgeon for proper management of the retinal detachment. And you must also write what the vitreoretinal surgeon will do for the patient. But at this time, you will write it in a theoretical. You are not a vitreoretinal surgeon, but you know what the vitreoretinal surgeon will do for this patient. So this is one example. Other example, you have a patient with multiple sclerosis and you diagnose the patient. You must not forget that you will refer this patient to a neurologist to treat this patient, because treatment and management of a patient with multiple sclerosis is not your rule. It is the rule of a neurologist. Your rule is just diagnosis. So you must tell the examiner that you will refer the patient to a neurologist to control or to manage this patient. And also you must know what the neurologist will do for this patient. Back to Dr. Hassanin and the question he asked about the conclusion at the end of the question. This is my approach in organizing your answer. I will start first by introduction, including differential diagnosis or diagnosis. And sometimes the problem solving sometimes you have only one diagnosis for the problem solving question, and in other times you have differentials. So you will start your answer by your introduction, your impression, including your diagnosis and your differential diagnosis. So the order, this is one of the mistakes I already see in our Telegram discussion for FRCS second part. They start their work up by history, examination, investigation, and at the end they write the differential diagnosis. How come? What are the aim of your workup? The aim of your workup to prove your diagnosis or to prove your differential and make the workup for this diagnosis and this differential. So the logic thing that you write your diagnosis or your differential diagnosis at the beginning of the question. Then you will start systematically by history, examination, investigations, management, and follow-up and prognosis. And in the follow-up and the prognosis, don't forget to speak about counseling. In some problem-solving questions, you need to counsel the patient. So don't forget the magic word. They like this word a lot in the exam, counseling. So Dr. Hassanin, I hope this is clear for you. This is my recommended order, and my always said word in FRCS exam is that no model answer. Maybe you have other organization for your answer, but this is my recommended organization for answer. The last point in my presentation, that what are the pitfalls in the problem solving exam. Writing in a theoretical way about the disease in general, not about this specific patient. Trying to write a lot more than needed and losing your time. And remember, unnecessary writing is equal to missing writing. If you write more than needed, you are losing your time, you are doing more mistakes, and this is not beneficial for your performance or your evaluation in the exam. So one of the pitfalls is trying to write a lot more than needed. Missing necessary points in your workup. Not having a clear, organized plan before start writing. Remote thinking, common is common. This is one of the fatal mistakes my colleagues do in the exam, either in problem solving or in final exam, that sometimes they have remote thinking about uncommon disorders, forgetting the common one. And a lot of examples. When we speak about leukocoria, we must speak about the most common and the most serious. So we must not forget about retinoblastoma, we must not forget about congenital cataract. Then we can list other causes. And like this. I don't want to lose in giving more examples, but remember, common is common. Also, one of the pitfalls is writing in long paragraphs without organization. Please make it in clear points. Avoid spelling mistakes and abbreviations. One of the pitfalls also is writing inappropriate or unsuitable words. Also, writing in wrong order in your workup, and I told all of you about my recommended order. Also, not starting by a clear differential diagnosis. The natural place for a differential diagnosis at the beginning of the answer. Also, writing a lot of irrelevant differentials. It is not a matter of a lot of differentials. Sometimes the answer is only one diagnosis. If you write it and prove it by your workup, you will pass. Don't be happy that you write a lot of differential. It is not like this. If the question deserves a differential, write differential. If you can prove that this question has only one diagnosis, write this diagnosis and sure you will pass. Also, one of the pitfalls is not aware about the most serious life or vision threatening or most common in your workup. You must be aware of the most serious and most common. Also, one of the pitfalls is the non-coherent workup. not targeting your differential diagnosis. This also one of the common mistakes I notice in the discussion group in Telegram. You start by writing differential, then in your workup you write irrelevant. For example, in your differential you write, for example, in the differential diagnosis of papilledema that you, for example, brain space occupying lesion, then idiopathic intracranial hypertension. Okay, this is in the differential. This is only what you write in the differential. And then in your workup you write, I will measure the blood pressure of the patient. Why you do this? Of course you do this because one of the differentials is malignant hypertension. But sir, you didn't write this in your differentials. So you must have a coherent workup. You must have an enjoyable story. You must imagine that the examiner is reading your story and the examiner is enjoying your story. If you have a coherent workup, coherent story, sure, the examiner will enjoy it and they will let you pass. So you write the differentials and your workup will be targeted to these differentials. And also in your workup you must explain what you will do, why you will ask about this, why you will do this, why you will investigate this. For example, the same example of papilledema, you will tell the examiner, I will ask the patient about drug history. This is not enough. You must write in between brackets because there are some drugs like tetracyclines, like steroids, that may cause idiopathic intracranial hypertension. So you must tell the examiner why you are asking about this. Also, in your investigation, you will write, I will do MRI for this patient. Why, sir, you are doing MRI? In between brackets, you will say that to exclude any brain space occupying lesion, and like this. Also, one of the pitfalls is writing without explanations. I already speak about this, and do it in between brackets. Also, one of the pitfalls, asking for unneeded investigations, and this is one of the features of the British school. British school want more history, more examination, only needed investigation. So, if you need the investigation, order it. If you don't need the investigation, don't order it. They don't like unneeded investigation, especially in the British school. In the American school, yeah, they order more investigation, but in the British school, it is a conservative school. Also, as I told you, one of the pitfalls is not referring the patient to subspecialty or other specialty when needed and appearing that you are the one who will treat. You are the magician. You will do everything. You will examine the patient. You will investigate the patient. You will manage the patient. You will give drugs to the patient. You will do surgery for the patient. No. This is not your rule. Once a subspecialty needed or other subspecialty needed, you must refer. But you must know what other subspecialty or other specialty will do to this patient theoretically. You must know this. But you are not the one who will do this. And I already give examples about this. The last point, and I told you they love this word, one of the pitfalls is not counseling the patient about his or her condition. For example, if you face a scenario of keratoconus, you must counsel the patient about his visual needs, about the treatment modalities, about the visual expectations, about the complications of treatment. The patient must know about this. You must respect your patient. You must involve him in your decision. You must involve him in your management plan, because at last you are treating a human being. You are not treating a science. You are not treating science. I finished my pitfalls and I finished my success keys. Thanks for all of you. I hope that these success keys are beneficial to all of you in your coming exam, either in problem solving exam or in final exam for Glasgow College. Before I give the mic to Dr. Ahmed, I will answer this question. How much time problem solving preparation may take after ICO2? Is 3 months is enough? 3 months is more than enough. And as I told all of you, smart study, not hard study. If you have any question about my presentation, if anyone has any comments, if Dr. Ahmed or Dr. Muhammad Saab wanted to add anything, all are welcome. Thanks a lot. I will give 1 minute for any questions. Okay, so I thanks for all of you. It's my pleasure that I added any if even a little point to any one of you.